I'm Dr. Wendie Berg, and I see patients at American Radiology Services, Johns Hopkins Green Spring in Lutherville, Maryland. I've conducted many research trials, including a recent study comparing high-resolution PET imaging of the breast, or positron emission mammography, to MRI in women with newly diagnosed cancer. So one of the most important results of our study was that we found PEM to be an acceptable alternative to MRI. And we know that many women have trouble with MRI for various reasons, either claustrophobia or if they have a pacemaker or metal implant of various types. And having an alternative to find additional cancer before the patient is treated for her breast cancer is actually very important. In the past, many studies have looked at MRI. It's a very sensitive test. It does show us additional cancer in a high percentage of patients who have it, but it's problematic because it will sometimes find additional lesions that are not cancer. And it's been shown in several recent papers that it actually does not reduce the rate of positive margins, and it does not actually reduce probably the rate of recurrence even. And so it's controversial. And meanwhile, many of these women will end up with unnecessary biopsies and even sometimes unnecessary mastectomy because of findings that were suspicious on the MRI. And so one of the goals of our study was to determine whether PEM might actually be more specific, in other words, less likely to prompt an unnecessary biopsy or even unnecessary mastectomy. And we were able to show that PEM is, in fact, less likely to prompt these adverse events. 2/3 of the biopsies that were prompted by PEM showed cancer, compared to only about 50% of those prompted by MRI. And that's a significant improvement in specificity. With patients who are contemplating chemotherapy prior to surgery, I think PEM may show a very important benefit because it gives us functional imaging of the tumor and a decrease in the amount of radiotracer glucose that is taken up by the cancer, may be even an earlier sign of response to treatment than what we can see with MRI. PEM is also accepted for looking at women with the newly diagnosed cancer. We know that we do get reimbursed in that situation for extent of disease. And it's also been accepted for reimbursement in the situation of patients who might have recurrence. Sometimes it's difficult to tell scar from tumor, and PET may have a better role than MRI in that situation. One of the advantages to PEM that we did find and that we're certainly well aware of, besides the fact that patients tolerate it very well, is also that it's much easier to interpret than MRI, where you have 12 images of the breast at a time, and we do it in 2 projections. So we have really 24 total images to interpret, and that gives us detail about where within the breast in 3 dimensions the areas of interest are. But it's much simpler to interpret that than to interpret the over 1,000 and sometimes up to almost 2,000 images that we have with MRI. We also have a lot of issues with motion, and again, because of claustrophobia, patients don't want to stay in the scanner for MRI. So even some of the women who come for an MRI can't finish a good quality MRI. And we even had a certain number of cases within the study where we thought the MRI was adequate and then realized later that the contrast had not successfully gone into the patient. There were various QC issues that were much more challenging with MRI than with PEM. We recently conducted a study as part of our Akron trial of screening ultrasound. We invited women who had been in that study for 3 years, getting annual mammogram and ultrasound screening, to have an MRI at the 3rd year time point. And it was surprising to us that fully 42% of women did not want to have the MRI. And there were a variety of reasons for that. But the most common reason was claustrophobia. And overall, across all of our patients, the rate of claustrophobia was almost 11%, which seems high, except that it is more common in middle-aged women. It's more common in women who are well-educated. And so it probably is a realistic number. We take for granted that we have a great test and of course everybody will want it, and I think that's not really the case. So having an alternative to MRI is actually very important.